Hi, Dr. Tim Clare with Pro Health and Wellness in South Charlotte Disc Center, and Thomas, our massage therapist. We're on our second, I believe this is our second talk about, what makes the difference in our office and what you can expect when you come see us. So Thomas, one of the questions I get a lot of times is, what does your massage therapist do? What are the different techniques that he offers, and what separates him from maybe another massage therapist down the road or at one of the boxes?
Anybody that comes into my treatment room basically has three options. I can give them a treatment that's completely relaxing, I can give them a treatment that's completely therapeutic, or something that's a combination of the both, depending on the individual, because I've always felt like massage should meet the individual where they're at and customize to the person and their needs. And relaxation is just that, which everybody needs to relax nowadays. It's very important to relax and decrease stress and stimulate the parasympathetic nervous system to bring people down off the fight and flight that they've been in all day. And that's really important. And I encourage people to seek relaxation. If massage is their thing, then come here and get relaxing massage. If you have pain in your body, if you're having problems with range of motion and dysfunction in your body, then maybe more of a clinical approach is appropriate. And the way I approach this is loosening and lengthening tissue that has become dysfunctional. And you use a lot of the same strokes that you would use during a relaxing treatment, but it's just how you apply it. And it's a lot of assessment, conversation with the individual before the treatment, and then searching the body for the dysfunction, finding where the tissue's at. And this is where the more you practice, the more proficient you become at distinguishing between healthy and dysfunctional tissue, and what that feels like, and what is a naturally occurring trigger point or spot of hypersensitivity because of structure and function, or when a spot of hypersensitivity or trigger point isn't supposed to be there because of structure and function. It's there because of lifestyle, repetitive activity. And you go in and you apply massage, loosen and lengthen. What I like to do is I like to massage an area and then stretch an area. Generally, people have problems between, let's say, the scapula and the spine, the shoulder blade and the spine. Sooner or later, we all have trouble either on the top of our shoulder or between the scapula and the spine. Well, you need to go there and you need to work that area out. You need to loosen and lengthen and restore function to that area. But if you only work on that area, the problem's going to reoccur. Because generally speaking, the reason the problem's there is because other aspects of the shoulder are pulling on that area. So you need to work around into the rotator cuff muscles, into the deltoid, into the serratus anterior, and then get into the pecs. Pec minor is a big offender. And this is where, the bones will do what the muscles tell the bones to do. So if your muscles are constantly tight, then it's constantly pulling you forward. And we can come in and loosen the chest cavity and loosen the sides of the shoulder and restore some function to this tissue, so you can get out of the head forward rather, shoulder rounded posture, and begin to open up and complement chiropractics into what you're trying to achieve with alignment. We can complement that by loosening the muscles that are pulling people out of alignment.
Right. And that's one of the reasons why I like working with Thomas too, and why we've always tried to have a massage therapist that we can count on as far as getting in there to really make a difference in the musculature and help us with the function. So I take that same approach after doing it for 29 years plus of chiropractic, that we're looking at what does the patient need, that not every patient needs the same exact treatment. And so utilizing a lot of different techniques, a lot of different skills, a lot of different studies of how to move the vertebra, whether it's utilizing a computerized system like the Pro Adjuster or more of a manual adjustment, even activator work, those are techniques that we use to move the vertebra, to get pressure off, to get the muscles to start to work better. But then oftentimes when they're really hung up, we can utilize the massage side of it to really get in there and make that difference too. So it gives us another component to working together on helping our patients.
Yeah, there's a real synergy between the two.
There is.
And the formula is different for everybody. They need more of this, more of that, and you try to figure out where that's at.
And so, and as a sports physician, oftentimes I see that when a person comes in for a shoulder, I'm working on getting that joint moving, I'm getting that restoration of motion, but ultimately we have to get the muscles working better for us too, because they are what move the joint. So we have to get that working in combination, in really unison, in order to make that correction. So I think it's a great component, and it's a great complement to each other. And that's the reason why we have it here for you. And we're going to do another one of these to give you a little more information. But remember, it's your future. Be there healthy, and if you really want to help yourself, that's what we're here for.